Health workers in Nigeria have urged governments at all levels to implement urgent and sustainable policies which recognize and invest in their safety as a precondition to ensuring the safety of patients. This was the thrust of a gathering organized by the Medical and Health Union in Abuja to commemorate this year's World Patients Day. TVC News correspondent Joke Adisa reports.
Every 17th of September provides an opportunity for patients, families, caregivers, communities, health workers and policy makers to come under one roof and deliberate on the safety of patients. A number of times, cases of patients who die untimely or suffer permanent disability as a result of neglect or oversight by health workers are recorded, putting into question the psychological and emotional state of the health workers. The outbreak of COVID-19 placed more burden on the health workers, who were more often than not the first contacts with the patients outside their homes. As the world marks this year's Patients' Safety Day,
very happy to have you.
This gathering draws the attention of all relevant authorities to the challenges facing patients and healthcare workers, as well as the dire need to ameliorate them.
Psychosocial hazard in the healthcare sector is becoming a thing of concern, where work overload has become a critical issue leading to medical errors. People work longer hours of time and people are not even catered for in terms of having safe practices in the workplace.
We lost a lot of our members during this COVID-19 pandemic, and a lot of affected. And the most unfortunate thing, the motivation that is supposed to be given by the government is not addressed directly to our members.
Elizabeth Izama has garnered many years on the field as a health worker. She tells me the safety and well-being of the caregiver should be the concern of all, including patients.
How do we save patients? We save ourselves. We protect ourselves, especially during this time, like using the PPEs being provided by the government, even though not enough. We take care of ourselves first before taking care of the patients and educating the patients on how to take care of themselves.
Some patients believe government at all levels should do more to appreciate the contributions of health workers for their safety.
Nurses, doctors, too much work. So if you have any demand, anything they're agitating for, let them look into it. Please, they are helping us.
The advocacy is for the adequate provision of personal protective equipment for health workers to guarantee their safety and that of the patients. Joke Adisa, TVC News, Abuja.